Hi, I'm Anulala, one of the editors-in-chief of JCF, and we're coming to you from THT. I'm here today with Elena Donald, this fabulous cardiology fellow, and also one of our fellow editors at the journal. Elena, I wanted to ask you, there is so much buzz about the shortage of heart failure physicians, why trainees are not choosing heart failure as a profession. And we talk about it amongst ourselves as the attendings, but from your perspective as a trainee, what are you hearing? What's the discourse like from the trainees' perspective?
Yeah, thank you so much for having me here. I think there are a few different themes that have been coming up when I talk to a lot of my co-fellows about why the interest in heart failure may be diminishing, and I think it's a lot about perception. I think the first thing is we see these heart failure doctors in the hospital working the long hours. They're the long days on the weekends, and we're not really sure, we don't get a sense of like, are they being compensated for all that time compared to some of the other attendings in the other subspecialties that we're seeing. I think there's also this, with the new interest in the critical care pathways, a lot of people who used to be drawn towards heart failure for those really sick, high acuity patients in the units, they're seeing that, oh, there's this other pathway where we can really just narrow our focus to the MCS and the shock without the ambulatory care piece of the heart failure. And some people are more drawn towards that level of acuity and have this alternative pathway now. And I think also people, it depends how you're perceiving those ambulatory clinics, because the patients are really sick in clinic. And some of us are saying like, well, maybe a lot of that primary care and a lot of these other factors are being kind of translated. And that's what the attendings are having to, you could say deal with in the clinic. But the reality is a lot of us are going into heart failure because we love that longitudinal piece, and we love being the person that our patients can come to for all of the questions, from the very simple, should I be taking this antibiotic, to what goals of care should look like, and for the long haul.
Yeah, I really appreciate your insights. What if you had to talk to us as a community? What do you think we need to do better so that it is more attractive to your co-fellows? Thank God you're going into the field and we're going to be better because of it. But what's the one thing you see as the elephant in the room that needs to be changed, and needs to be changed now?
Yeah, I think it's going to be a lot about the way that you present the job kind of to the fellows, and that you want to be there throughout those long processes, and you enjoy those, the ambulatory piece just as much as you do the patient on the Impella 5.5 who needing escalating support in the CCU. And also that the reality is, you are compensated for your time, and that I think a lot of us are really worried about our salaries and the loan forgiveness, and with the extended training that we're having to do to go into these subspecialties, that's another year of like not making a higher salary, and just kind of providing some reassurance that those things like are taken care of.
Yeah, you're happy. You're absolutely right. The last thing I'll say is, I have been really advocating for more ambulatory exposure to trainees, because you're right, you do often see us in the hospital, we're exhausted, that's our week on service. And so maybe seeing a more balanced way of how we live our lives will be helpful for trainees' perception.
Yeah, absolutely. I mean, the amount of heart failure clinic exposure that we get is almost minimal. It's just what happens to come through our fellowship clinics before we refer them for advanced cardiac care. And so seeing that piece of your job and that completely different element when you're not rounding and managing all of the sickest patients in the hospital at one time, and what your life looks like those weeks too.
That's perfect. Thank you so much for your insight. We've got some work to do, hopefully to attract more people like yourselves into our field. Thanks so much for tuning in. This is JCF at THT.